Good day, I am Jasmine Madasudanya from BSN 111B, and for today's video, I will be performing the parenteral medication administration return demonstration using the intradermal, subcutaneous, and intramuscular injection. So prior to the conduct of the procedure, first thing to do is to check the doctor's order on the patient's chart to know what are the medications to be given to the patient. And also, the chart of the patient is more reliable than the medication ticket. And then perform hand washing to deter the spread of microorganisms and avoid cross contamination. So now I am going to perform the intradermal injection. So the intradermal injection is the introduction of a solution by means of syringe and needle into the superficial layer of the skin. So now I am ready to administer the medication. So first thing to do is to check the doctor's order on the patient's chart because it is more reliable than the medication ticket. So now I have to introduce myself and verify the client's identity and explain the procedure to the client. Good morning, ma'am. I am Jasmine Madasudanya, your student nurse from Davao Doctors College. May I see your wristband, please? Kindly state your name and birthday. Thank you. So, ma'am, Dr. Strong has ordered a speed test, which means that I have to inject a minimal amount of medicine to your skin to identify any allergens to which you may be hypersensitive. Will that be alright with you, ma'am? So next, perform hand washing and observe appropriate infection prevention procedure. Now arrange the medication card on the hypodermic tray with the corresponding drug. So the rationale for this is to organization and planning results in economy of time and effort and minimize confusion. Now choose an injection site free of lesions and discoloration. So select the site 3 to 4 finger widths below the antecubital space and one hand above the wrist. So the forearm is convenient in this location for the introduction of agent intradermally. Thus, this is the site that I chose. So position the patient's arm so that her elbow and forearm are supported in a flat surface. So now I will apply clean gloves. Now use an antiseptic swab to clean the site beginning at the center in circular motion and then upward about 2 inches to 5 centimeters. Okay, let's just wait to let it dry. So now grab the syringe and remove the cup. So hold the syringe between the thumb and the forefinger of the non-dominant the dominant hand with the bevel of the needle pointing up. So now stretch the skin taut of the injection site by pulling gently with the thumb and forefinger of the non-dominant hand. So this provides an easy entrance into the intradermal tissue. So now pull the needle very close to the patient's skin and insert it slowly to 5 to 15-degree angle until the resistance is stopped. So now advance the needle up to the epidermis about 1/8 inches. So now stabilize the syringe and needle, then um, inject the amount of solution slowly while watching a small wheel to appear. So if a small wheel appears, all the solutions are in the intradermal tissue. So now withdraw the needle at the same angle that it was inserted. Then pat the site using a dry cotton ball and don't massage to minimize tissue damage and discomfort to the patient. Now encircle the wheel. I will dispose this in the um, waste receptacle. Fill the with blue or black pen only because red pen may influence the reading and instruct the client to or the watcher not to rub the wheel or erase the mark because massaging the area may influence the test result by spreading the medication subcutaneously. So as well, please do not rub also this area for a few minutes so get an accurate result. So now assist the patient to a comfortable position and indicate at the back of the medicine ticket the site and the due time for reading. So this will serve as a reminder for the nurse to on the procedure done. So now, so now perform hand hygiene and document the procedure. And documentation prevents medication error. So then interpret the result after 30 minutes. So I will now perform the subcutaneous injection. Subcutaneous injection is the introduction of a small amount of solution by means of syringe and needle into the adipose tissue beneath the skin. So I will now administer the medication. So first thing to do is to check the doctor's order on the patient's chart because it is more reliable than the medication they get. So now I have to introduce myself and verify the client's identity and explain the procedure to the client. Good morning, Mom. I am Jasmine Daniel, your student nurse for today, and I am here to administer your allergy shots. So this time it will be on your arm. So this medicine will stop and reduce your allergy attacks. Will that be alright with you, ma'am? Now perform hand hygiene and observe appropriate infection prevention procedure. So now arrange the medication card and the hypodermic spray with the corresponding drug. So organization and planning results in economy of time and effort and minimize confusion. So now determine which side to use. So I will use her upper arm, which appears to be the healthy and free from irritation and inflammation to reduce the discomfort of injection. Next, palpate the site and avoid any area that is tender. So to make sure that I have the right size needle, I will use my thumb and forefinger to grasp a skin fold of tissue at the injection site and measure the fold from top to bottom and check to ensure that the needle is about half as long. So now place the patient in a comfortable position and ask the patient to relax the area you are about to inject. So ma'am, can you please sit down? Okay, please relax your arms now. So now I have to apply clean gloves and clean the site with an antiseptic swab in a circular motion starting from the center outward. Now grab the syringe and remove the cup by pulling it straight up. Now hold the syringe between the thumb and forefinger of the dominant hand as if holding a dart. Now grasp the area of the surrounding site of the injection and insert the needle quickly and firmly at 45 to 95-degree angle. Now release the pinch of the skin and rest your non-dominant hand on the patient. Now move the dominant hand at the end of the plunger and slowly inject the medication over the several seconds. So now quickly withdraw the needle and place a swab or gauze pad on the site and apply gentle pressure but don't massage the area to minimize skin tissue damage and patient discomfort. Now place the patient in a comfortable position and document the procedure and record the time and amount of the drug on the medication ticket. Now dispose the used syringe and the cup on the waste receptacle to avoid needle prick injury. Now I have to remove my gloves and perform hand washing. So now I will perform the intramuscular injection. So intramuscular injection is the introduction of medication deep into the muscle tissue where a large network of blood vessels can absorb it readily and quickly. So now I will administer the medication. injection. So first thing to do is to check the doctor's order on the patient's chart because it is more reliable than the medication ticket. Now I have to introduce myself and verify the client's identity and explain the procedure to the client. Good morning, ma'am. I am just Daniel, your student nurse for today. May I see your wristband, please? Can you state your name and birthday? Thank you. So, ma'am, I am here to inject a tetanus toxoid on your upper arm as prescribed by your doctor, Dr. Strong. So, this medicine will prevent dangerous infections. And when you get tetanus vaccines as recommended, your body makes antibodies that will help your immune system fight the toxin produced by the bacteria. So, ma'am, after a few minutes after injecting the vaccine, you will feel numbness or pain on the injection site, which is actually normal. So, will that be alright with you, ma'am? To perform hand hygiene and observe appropriate infection prevention procedures. Now arrange the medication card on the hypodermic tray with a corresponding drug. So organization and planning results in economy of time and effort and minimize confusion. Now select an appropriate site for the injection. So this time I will use the deltoid muscle of my patient because it is close to the lymph nodes located just under the armpit. So next, examine the integrity and amount of the patient's muscle mass and palpate the muscle area of tenderness, which is not suitable for injection sites. So next, inspect the area for bruising, inflammation, and edema. So if the skin shows bruises or inflammation, use another site. So as I can see here, my patient doesn't have any bruises or inflammation on her deltoid area. So now help the patient find a comfortable position that will accommodate the injection site chosen and expose only the portion of the body. So ma'am, can you please sit down? Now I have to apply clean gloves and use anatomical landmarks to find the site again. So ma'am, may I ask, are you left-handed or right-handed? Okay. So because my patient is left-handed, I will inject at her right arm, which is her non-dominant hand, because later on, after she injected, it will get sore. So now disinfect the injection site in a circular pattern from inner to outer for about 2 inches to prevent entry of microorganisms into the tissue. Now hold the gauze pad between the third and fourth fingers of the non-dominant hand, and then grab the syringe and remove the cup by pulling it straight off. And then hold the syringe with the thumb and forefinger of the dominant hand as if holding a dart. So now place the ulnar side of the non-dominant hand just below the inspection site and pull the patient's skin laterally about 1 to 1.5 inches. So hold this position until the needle is inserted. So now Aspirate the syringe by pulling back the plunger with the dominant hand, and if blood appears, then you are not in the muscle. So remove and discard the needle and the syringe and start over. So if there are no bloods, then you may proceed. So now inject the medication slowly at the rate of 1 ml to 10 seconds. And wait 10 seconds and smoothly withdraw the needle. So now release the skin and place the gauze pad on the site and apply gentle pressure but do not massage the area to minimize tissue damage and patient discomfort. So now lastly, place the patient in a comfortable position and document the procedure. Now I have to remove my gloves and